Dr. Kamaraj, Dr. Nirmal, Additional Director, Dr. Rama Madam, Dr. Priya, Dr. Prakash, and many of you I may not know by name, but welcome you all. And this is a special occasion where a state government program and a non-governmental organization come together for a very, very, very important and valid activity, I will say. And my opinion is always do the process, the outcome is expected. And outcome, if you only see the outcome, then you will count on numbers. So whenever there is a process, particularly in the state department, government department, right from the year of independence, we have achieved a lot of numbers in various departments, not only in health, education, social development, roads, for that matter, any aspects. If we go into the health, our current mortality rate, maternal mortality rate is 25, and as rightly pointed out by the Kamaraj, that it is next to Kerala, and our infant mortality rate is 11, and many other immunization is 90. We can go on telling numbers, but ஒரு சின்ன தமிழில் சொல்கிறேன். என்னுடைய குழந்தைக்கு ஒரு நகம் பிஞ்சு போச்சுன்னா, நார்மல் சைல்டு ஒரு 3 வயசு குழந்தைக்கு நகம் பிஞ்சு போச்சுன்னா, ஐயோ என் பொண்ணுக்கு குழந்தைக்கு நகம் பிஞ்சு போச்சு அப்படின்னு 10 வீட்டுக்கு பேசுவோம். The child is normal, the child is healthy, the child has developed well, and the child will be taken to Apollo hospital or some other hospital which is the best hospital. It depends upon the parenting, it depends on the emotion of the parent, it depends upon the affordability of the parents. But the government and organizations like this look after only those who are vulnerable. We work always for vulnerable, and as we can say equity or we can say inclusivity, the terms doesn't matter, but working in the field is very, very, very difficult. We have a health system of nearly 2,336 primary health centers, 9,355 health sub-centers, and we have nearly 11,000 volunteers working with us, and somewhere around 2,650 ASHAs working in remote areas. With a lot of difficulties only these people work. But the achievements have not attained by the health department alone. It is not only public health. Within health, we have Director of Medical Education, Director of Medical Services. Madam Rama, Madam is a witness to this. And not only in Tamil Nadu, in any state. But it is not only the directorates, but we have worked with organizations like UNICEF, WHO, and also non-governmental organizations. We have come together in many occasions. We have achieved. This is one of the, again, it's a milestone where we were talking about, you probably all know about RBSK, Rashtriya Bal Swasthya Karyakram. It covers children between 0 to 18 years, identifying to diagnose and treat or manage nearly 30 conditions. And these conditions are collectively called as 4 Ds: disability, defects at birth, developmental delays, deficiencies, and diseases. And somehow we have tried to identify children and try to manage with a system called RBSK, screening all children from school, from Anganwadi, and at the point of delivery, and also at home. It's very challenging task even to do a delivery point screening. And disclosing disclosing an issue to a parent that your child is having certain problems is very again challenge. Particularly when you go to home, do a survey or do an assessment and say a parent that your child is having this problem or even deficiency. This is actually it's a they will it's unexpected issue for the parent and challenge at Anganwadi and school are we miss so many children. We miss so many deficiencies, so many defects because all children are not available at Anganwadis. All children are not available at school when the doctor team visits. I am telling this because people sitting here should understand what are the challenges for each child having missed for getting diagnosed. Now, particularly one activity which Bala Mandir Trust along with UNICEF has come forward to work with us is and finding an opportunity to identify those missed children or those who have not or those who are not aware or those who have not come for the screening. Earlier and even now, our structure is very systematized, helps particularly for the ANMs. Monday they will have ANC clinic, Tuesday they will have the review and other ANC clinic at the primary health centers. Wednesday the children will be immunized and in the afternoon there will be a well baby clinic. And Thursday it is a school health program. Friday mothers meeting and other activities by the ANMs. This is the overall structure throughout India. Tamil Nadu health system diligently followed this, but somehow there were challenges. And now after having established RBSK program in 2015, the screening for children was little upgraded and the activity was upgraded. And instead of children coming to the schools, instead of children coming for the well baby clinics or to the health sub-centers for screening, the dedicated teams are going to the schools and Anganwadis. In these circumstances, even with all these efforts and all this background, children are being missed. And the activity suggested by Bala Mandir Trust along with the real frontline workers, Dr. Pooja, Dr. Kannan, and our additional director, Dr. Vinay, is not here. He is in Kerala now, Karnataka now. So those dedicated people, and along with Bala Mandir Trust people, they have established a system in Gumadipundi. Gumadipundi is madam. Gumadipundi block, where usually we say whenever we say missed opportunities, the doctors always remind to know that it is about immunization. Now this missed opportunity strategy has been introduced to identify those children who are missed by the routine health system. For identifying these 4Ds, I told you about 4Ds, identifying the developmental defects at birth and developmental delays. Whenever the child is taken to the immunization center, there is either Anganwadi or sub-center, we have a set of protocols developed by a team of experts and they are identifying children with these 4Ds. We have identified so far around 8 to 10 children now in the past 2 months. Am I right, Pooja? 10. See, the 10 is a small number. This is in one block. Really, I am happy because we have treated nearly lakhs and lakhs of children, and we have done surgeries, cardiac surgeries, cleft palate surgeries, congenital dislocation of hip correction, this heart surgeries, rheumatic heart disease, all these surgeries we have nearly done 30,000 surgeries and saved 30,000 lives of the children. And as rightly said, it is beyond survival. It is not only survival, it is a quality of life, and the child has to develop, child has to live, child has to get included in the society. That is what is meant all about this whole program. So if you miss some child, then it is a real failure of the system or failure of the parent, we do not know. Let us forget about that. But one simple project, simple concept, simple strategy has identified 10 missed children, and now they are inducted into a treatment. So this is an example where if you have some hand holding with hand holding means not for learning, it is joining hands with by different organizations, we can do much and much better. And now the life expectancy being more than 74, every child wants to be included in the society. There are many schools, and at one point of time the special school attendance should come down. That is our aim. And I cannot go on talking to you. I have an emotion to talk to you a lot about the children. I can talk for a day, and we have a lot of work done, a lot of success we have seen along with all organizations. But I will say that we work together, and state government and health department particularly, as Mr. Kamaraj was mentioning, to my knowledge, I have worked with UNICEF for past 23 years. And these 23 years really had, every year we had gone a step ahead in all programs, and we have achieved many things. I would like to continue the support, and also from Madam, and probably the activities introduced by any organization, not only by Bala Mandir Trust, and learning from other states, because we have experts from other states. Mutual learning from states will definitely bring a lot to children, and the survival of the child should be a happy and also of a high quality. That is our aim. Thanks for inviting me. Really, I am happy because I have avoided one program, particularly not to attend this program. Because that is adolescent, this is child. So child is a priority. Adolescent, we go next. Thank you.